soaked. I had the swelling. I had swelling so significantly, not just in my lymph nodes, that my right ear became swollen shut, along with fever, along with headache, along with body ache. And I was that close, phone in hand, to calling 911 because I just didn't think I could make it with how I felt. A neighbor of mine gave me great advice when I called him at 9 o'clock, and he said, "Don't panic." But I was so ill, I had to take Pebbles and put them with a neighbor because I didn't think that, one, I could care for her, and two, I was deathly afraid that I could give it to her. And thankfully, my doctor did some research and found out that there are only a few set of animals from which the disease may have begun that can go from human to animal. And I also checked with my vet, who did a lot of research, and said it's extremely, extremely unlikely. And he had actually said, "Get Pebs back. You need her to help you feel better." And so I did. As time went on, the symptoms did begin to reduce. I took steroids to get the swelling down, to get my ear opened up, but there's no real treatment for the disease. In theory, there are some antivirals. However, I was the only guy in the county who had this. And it's not like your doctor can call in a prescription and go pick it up at Walgreens, right? They just aren't available on a widespread basis. Now, about 24 hours after the county looked at my case, it's my understanding that they denied the test. So all of the testing has to be approved at the county level or the state level, and then it has to be conducted by that county or at the federal level. And so my understanding is they had confused me with another patient, which my doctor's office worked speedily to correct, and they finally gave approval to have that test done. So my doctor did the test. We shipped it off to Riverside County. And a couple of days later, the message was, "Hey, we have to do it again with another county." So it seemed to me that somehow Riverside could not process this test properly. I don't know. I'm assuming that. So we did it with San Bernardino County, and in about 36 hours, which I thought was very quick, it came back as presumed positive. And the way this works is that if you have the test done by the county and it's positive, it's presumed, but it's not finalized until you do yet another set of tests that are sent to the CDC. And that takes about 2 weeks. And so, during that period of time, I continued to have a fever. I had a fever for 3 weeks straight, maybe even a little longer. Not a debilitating one, but one that gets your attention. And I was waiting for the lesions to dissipate and go away, and the progress was really slow.